My name is Billie Jane Hermosura, and in this presentation titled Recognizing Leadership in Dietetic Practice, Dietitians' Leadership and Alignment with the LEADS Framework, I will present the findings from phase of my doctoral research, which I recently completed. Leadership in the health workforce continues to be recognized as a key factor in improving healthcare and is considered part of professional competence in health professions. Dietitians continue to find their place within the healthcare hierarchy and the ways in which they can be recognized as leaders in the healthcare system. In dietetics, the integrated competencies of dietetic education and practice, a document which informs dietetic education and professional development in Canada, was revised to include leadership as part of a new competency domain. Little is known about Canadian dietetic leadership development. Currently, literature in this area stems from traditional areas of dietetic practice in clinical nutrition and food service management, where leadership tends to relate to positional authority. There is limited research connecting leadership, dietetics, and competency-based education. Although there is evidence that dietetic curricula attempts to distinguish between leadership and management, there is less agreement whether to include leadership as part of dietetic curricula. The objective of one of the phases in my study was to understand the ways in which dietitians use leadership in practice and how their experiences align with the LEADS in the Caring Environment framework. Before I talk about the methods, I will briefly explain the LEADS framework. As a uniquely Canadian contribution to the Healthcare Leadership Scholarship, LEADS was foundational to my research on dietetic leadership development, and I use it as part of my Phase 2 analytical framework. LEADS is built around the notion of capabilities rather than competencies or minimum entry level requirements, and can be applied to leadership along the career trajectory. LEADS is designed to showcase capabilities required of both formal and informal leaders. It proposes that all leaders, regardless of their position in the organization, must be able to lead themselves, engage others, achieve results, develop coalitions, and affect systems transformation, which are the 5 domains in the framework. LEADS was designed to be common to all in that the framework is not intended to specify how diverse groups within the healthcare workforce operationalize its capabilities. The different domains become a common language that people can use in discussing and sharing their leadership experiences, which would be expressed differently in different professions and unique contexts. My thesis was a multi-phase study. Today, my presentation focuses on Phase 2, shown in yellow. In Phase 2, which was my most intensive phase as depicted by the larger circle, I use a multi-case study methodology to identify dietitians' leadership skills development and use in practice. I interviewed 35 dietitians. Audio recordings of the interviews were transcribed verbatim. Then I reviewed interviews by using a case study extraction tool and writing a case summary report. After analyzing and organizing 35 interviews into career cohorts, I purposefully selected 18 interviews for deeper cross-case analysis, where I considered each participant as a case. The selection criteria was based on diversity, variety of practice setting, and richness of interview. This table shows the career stages, participants selected, their practice settings, and the number of participants who identified with at least one of the diversity categories. Again, this presentation reports on one sub-question of Phase 2 of a broader research study. The question I asked was, in what ways are leadership skills used in dietetic practice, and more specifically, how do the ways in which dietitians use leadership skills align with LEADS? All four cohorts provided personal examples of their leadership skills and practice that aligned with each of the leads domains and most of the capabilities. All cohorts use their self leadership in some capacity in their day to day work, which was described as transferable leadership skills or having certain leadership characteristics. This observation was unsurprising, yet highlights how dietitians need the ability to self lead throughout their careers. The experiences that dietitians in my study talked about provided extensive examples of how they engage others as part of their day to day leadership practice. From being a preceptor to dietetic interns to collaborating with other health professionals and community partners, the dietitians draw on their ability to communicate effectively, foster the development of others, and contribute to a healthy team environment. Dietitians at all career stages provide examples of how they achieve results, develop coalitions, and contribute to healthcare systems transformation through their work, the other three leads domains. I found that dietitians who had more experience provided richer responses to these questions. Early career dietitians were able to describe what they do in practice, but their experiences did not go into as much detail as dietitians in their mid and late career cohorts. The mid and late career dietitians' experience varied, and they described their experiences with more details, often talking about the impact their actions had on others or the system. Dietitians' perspectives on what leadership is were identified. The findings suggest that dietitians' leadership in practice is varied and might relate to an individual's understanding of leadership. In practice, generally, dietitians appeared to recognize different forms of leadership beyond formal positions, and their examples map to each of the domains. The findings demonstrated that dietitians use leadership in a variety of ways and contexts throughout their careers. Distributed leadership appeared to be the most common way dietitians described how they use leadership in practice, whereby leadership was not related to having a formal role, but rather how leadership is used between those they work with. My study contributes to the research related to the LEADS framework by applying it to the dietetic profession. The LEADS framework enabled me to distinguish leadership at the different levels. To my knowledge, research connecting the LEADS framework and dietetic education and practice has not been explored to the extent my study has, which I have found that dietitians at all career stages demonstrate leadership capabilities. Findings from this study might suggest that although dietitians were not formally taught leadership skills through their dietetic education, there is evidence that they possess and use leadership in their different practice areas throughout their career trajectory. My study highlighted that dietitians use leadership throughout their careers and in different practice settings. Although dietitians have not been taught leadership through dietetic education, leadership is essential in dietetic practice. My study also helped highlight that more research on allied health professions leadership is needed. Very little is known about leadership in allied health professions, yet effective leadership at all levels of the health system continues to be considered essential to meet the health needs of Canadians. Thank you for listening, and you may get in touch with me if you'd like to learn more about my research or if you have any questions. Thank you.